για τον λόγο η Δ. Μαριάννα Τρίας, εκπρόσωπος του Π.Ο.Υ στην Ελλάδα, για να κάνει και αυτή τον εναρκτήριο χαιρετισμό της εκδήλωσης. Dr. Mariana Trias, we can hear you.
Dear Deputy Minister, Mr. Kondozamanis, Presidents of the Panhellenic Medical Association, the Panhellenic Physiotherapists Association, and the Hellenic Nursing Regulatory Body. Dear guests and colleagues, good afternoon, Kalispera. Thank you very much for being with us today and for participating in the official presentation of the WHO Guide, Support for Rehabilitation, Self-Management after COVID-19 related illness. Rehabilitation is an essential, yet quite often overlooked part of universal health coverage, together with promotion of good health, prevention of disease, treatment, and palliative care. Even before the pandemic hit us, about 2.4 billion people around the world were living with a health condition that could greatly benefit from rehabilitation. The COVID-19 pandemic has highlighted even more the importance of rehabilitation as an integral part of the continuum of care. Many patients who have had a severe form of COVID-19 are often in a dire need of rehabilitation due to post-intensive care syndrome, physical deconditioning, respiratory, swallowing, cognitive, and mental health impairments. The typical recovery time for patients with mild COVID-19 have been reported to be about 2 weeks, while it may take up to 8 weeks to recover for those with more severe illness. However, a significant number of people continue to show symptoms like extreme fatigue and persistent cough over a longer period of time. Understanding and addressing the recovery phase of the disease has been one of the priority areas of work of WHO. With our global clinical network, WHO is working to create a standardized data system to capture relevant information globally and to advise on longer-term support. In the meantime, there is already a lot we can do to help people with self-management and recovery. We have tools and exercises in our disposal which can greatly facilitate the rehabilitation and self-care of COVID-19 patients after their hospitalization. The WHO country office in Greece has translated and adapted WHO's official guide entitled Support for Rehabilitation, Self-Management after COVID-19 related illness into the Greek language. The purpose of the guide is to use simple graphics and language which is easy to follow to describe a series of basic rehabilitation exercises for adults who have been hospitalized with COVID-19 and who continue to their complete recovery. The guide addresses the common residual COVID-19 symptoms, specifically breathlessness, difficulty in resuming exercise or functional activities, mental health, and post-intubation symptoms such as voice weakness, eating, drinking, and attention and memory deficits. We have already published a digital version of the guide on the WHO country office website and shared it with partners. And as was already mentioned by Mr. Kondozamanis, 10,000 hard copies have also been produced. Nevertheless, we hope that the guide will reach the hands of patients in need. For this initiative, the role of health professionals is crucial. Doctors, nurses, and physiotherapists are the key for the recovery and rehabilitation of patients recovering from COVID-19. These health professions hold strong personal connections of trust and confidence with the Greek patients who could benefit from this guide. We are grateful for the support and presence of the Pan-Hellenic Medical Association, the Pan-Hellenic Physiotherapist Association, and the Hellenic Nursing Regulatory Body, in addition to, of course, Ministry of Health, in this discussion and in disseminating the guide through the networks and members. Dear colleagues, along with a difficult second wave of COVID-19, we must remain vigilant and maintain our progress in fighting the pandemic. With new knowledge and advancements on the prevention and protection from the virus, as well as on the management of COVID-19, including rehabilitation and self-care, there is promise that we can defeat the virus and its longer-term health impact. Finally, throughout this process, we must continue working together and supporting each other. From our part, WHO will continue facilitating a broad platform of cooperation so that we can all guide Greek citizens with their rehabilitation and self-management after COVID-19. Ευχαριστώ πολύ.
Thank you very much, Dr. Trias. Ευχαριστούμε πάρα πολύ τη Dr. Trias για την εισαγωγική της